Parkinson's disease. Today's topic is about Parkinson's disease. So, what is Parkinson's disease? Parkinson's disease is a progressive neurodegenerative disorder characterized by motor and non motor symptoms due to loss of dopamine producing neurons in the brain, specifically in a substantia nigra. And here's the picture, and here's the location for substantia nigra. Okay, let's talk about Parkinson's disease symptoms. It is divided into two parts, as I mentioned before in introduction, that it has motor symptoms and it has non-motor symptoms. Motor symptoms consist of tremors at rest, bradykinesia, it means slowness of movement, rigidity, it means muscle stiffness, and postural instability, balance problem, basically. Non-motor. Non-motor is like sleep disturbance, depression and anxiety, cognitive impairment, autonomic dysfunction, for example, constipation, orthostatic hypotension. So basically, motor and non-motor symptoms. Parkinson's disease symptoms, I think this picture will beautifully explain everything about the symptoms, and I love this picture because it has a mnemonic, which is TRAP. T stands for tremor, R for rigidity, A for akinesia, and P for postural and balance problem. Parkinson's disease factors. So basically, we have two different factors. One is risk factor. What are the risk factor that it candidate as to Parkinson's disease? And we have protective factors. And there are factors that protect us against Parkinsonism. The first one is age, the greatest factor, the greatest risk factor, but in terms of age, remember, more than 90% over 60 and about 10% less than 40, and living in rural area, well water intake, and exposure to pesticide also considered risk factor. Coffee, smoking, and estrogen for postmenopausal are considered protective factors. Parkinson's disease diagnosis clinical. So basically, it is a clinical diagnosis, but let me divide it into three parts so that it become a little bit more easier and more clear for you guys to understand. For example, how clinical diagnosis based on history taking and physical examination, and also presence of bradykinesia with either tremor or rigidity is diagnostic. Last but not least, you have to exclude Parkinsonian syndrome or secondary causes for Parkinson, for example, medication-induced Parkinsonism and vascular Parkinsonism. Let's move on. Let's talk about Parkinson's disease investigations. So basically, for the investigations, we do imaging and lab test. For the imaging, we do MRI and CT scan of the brain to rule out other causes. Dopamine transporter scan when the diagnosis is uncertain or unclear. So basically, imaging can be used in order to exclude other causes. Lab test, it is not actually required for the diagnosis, but generally for the exclusion of other condition, it can be used. Let's move on to Parkinson's disease treatment. For the treatment, I would like to divide it into three parts. First one is pharmacological treatment. Second one is, let's talk about pharmacological treatment. Levodopa is the mainstay of treatment, usually combined with carbidopa. Dopamine agonists, most commonly used pramipixole and roprinol. monoamino oxidase B inhibitor selegiline, rasagiline, and COMT inhibitor entacaptan. It actually prolonged the effects of levodopa. Non-pharmacological, we can use physiotherapy to improve mobility and balance, occupational therapy to assist with daily activity, speech therapy to address speech and swallowing difficulties. Now, last but not least, surgical treatment. The most important one is deep brain stimulation for the patient who is not responding to medication treatment or advanced Parkinson's disease with motor complications not adequately controlled with medication. And basically, this is a picture of deep brain stimulation. Let's do a few MCQ questions. We have a 65-year-old man presents with a resting tremor, keyword for Parkinson, on his right hand. It is usually asymmetric. Slowness of movement, bradykinesia, and stiffness in the muscle, rigidity. He also reports difficulty maintaining balance, poor posture while walking. His symptoms have progressively worsened over the past year. On physical examination, you note bradykinesia and rigidity. What is the most likely diagnosis? Is it essential tremor? No. Is it Parkinson's disease? Yes. Is it multiple system atrophy? No. Is it amyotrophic lateral sclerosis? No. The correct answer is B, Parkinson's disease. Let's move on to the last scenario of this lecture. MCQ number 2, a 70-year-old woman diagnosed with a Parkinson's disease presents for a follow-up visit. She has significant motor symptoms, including bradykinesia and muscle rigidity, that affects her daily activity. You are considering starting her on medication to improve her symptoms. What is the mainstay of treatment for her condition? What is the mainstay? Is it dopamine agonist? No. Is it monoamino oxidase B inhibitor? No. Is it levodopa? Yes. Is it anticholinergic? No. The correct answer is C. Thank you very much, everyone. This video is an educational medical video. It is prepared and posted by me, Dr. Muhammad Nasiri Jala. The main purpose of this information and educational video is to keep Afghan female medical doctors, students, and healthcare workers up to date with the latest medical knowledge, especially those who are deprived of their basic right to study and save lives. It is also aims to raise health awareness for all Afghan and Afghanistan. This informative video may also help international medical graduates who are preparing for their licensing exam in Canada and those who are preparing for NACOSKI as well. Thank you very much. I hope you guys liked it and found it fruitful. And if you have social media, please go ahead and share it. Like our page, subscribe our YouTube channel, and share it with your family and friends. I have been using a lot of references for my videos. The main one is Toronto Note and Uward Usumle. Toronto Note is the main source for the Canada and Uward Usumle for US.